Hey guys, welcome back to another episode of A View from Rounds Tower. Today I'm outside of the Samuel Reed Hall building, which used to be a dorm. Some of you might remember when you were at Plymouth. Today our DPT students are inside taking classes, and we're going to go find Rodney, who's going to interview some of them.
Thanks, Carson. I'm here inside Samuel Reed Hall building. I'm actually on the third floor. The third floor is the nursing space, but our DPT program will utilize some of the nursing classroom in the summertime for students to be able to get access in kind of that hospital clinical setting, which is what our nurse space is set up for. We'll also make our way down to the second floor and get into one of the Doctor of Physical Therapy labs and see students in action there too. So follow along. We'll head there next. Hey everybody, I am in the Doctor of Physical Therapy classroom space, one of the many classroom spaces here in Samuel Reed Hall building, and I'm with three of the second year students here in the program. I'm going to let them introduce themselves a little bit and tell them a little bit about themselves, and then I've got a few questions for them. So you want to start us off?
Yeah, I'm Parker Paradise. I'm from Littleton, New Hampshire. I'm a second year student in the PSU DPT program. I did my undergrad at Merrimack College.
Zach.
My name's Owen Kamuda. I am a second year physical therapy student here as well from North Shore, Massachusetts, and I did my undergrad at Plymouth University in Connecticut.
I'm Lily Swain. I'm also a second year student here on the DPT program. I'm from Bangor, Maine, and I did my undergrad at St. Joseph's College in Maine.
Well, another question for you then. Would you tell us what's going on today in here? What are you guys doing as second year students, and who are all these students?
Yeah, so we're all TAs for the anatomy lab section for this cohort of PT students. And as you can see right now, we're just having them go through some basic glides to assess for different motions at the knee joint. Today we're focused on the knee, so we're doing a little bit of knee and a little bit of hip, manual therapy type of things. And we're just kind of helping give tips as they're needed as we're going through.
Fantastic. So would you share us a little bit about what is it like being a TA in a class that you probably just took like a year ago, right?
Yeah, in some ways it's kind of great because we get to refresh our memory about everything because we come into it kind of having a good idea of everything.
Sure.
But then there's little things that you forget and some anatomy things that you don't really remember. So it's kind of great in that way to remember and get a refresher as well. And so, yeah.
Sure. How did you guys get selected to be a TA?
We went through like an interview process. So there's 7 TAs. 3 of us are here right now. 4 will be on Thursday. So we went through our interview process where we had to like do a mock teaching assignment on the shoulder. We had to walk up professors through the shoulder mechanics and some muscles and everything like that.
Fantastic.
The people that they thought did the best.
Congratulations, you guys among those. Yeah.
Thank you very much.
That's fantastic. That's fantastic. Would one of you, would you want to show us maybe what some of these students are doing? Could we go over to one of the students and you could kind of give us an overview? And
So here we have Nick and Connor, who are going to be showing us what we're working on in anatomy recitation today. Connor is going to do a anterior and posterior mob on Nick, and this is kind of just testing the ligaments of the knee. In more simple terms, we're just seeing how those two bones move along each other. Good job. His ACL and PCL are good.
so I'm with a student who's a first year here in the Doctor of Physical Therapy program. And tell me your name.
I'm Gracie.
Where are you from, Gracie?
I'm from St. Albans, Vermont.
St. Albans. Where did you do your undergrad?
I went to University of Vermont, and my bachelor's is in exercise science.
Exercise science. Why did you choose Plymouth State?
I actually went to Plymouth State for my first year, and I loved it. And for many different reasons, I ended up transferring. And once I knew that they had a DBT program, I had to come back.
Oh, that's great.
I love the community and everything about it.
That's fantastic. Well, that's kind of a full circle thing. Started here, and then you're going to get your doctorate here. That's great. So tell me a little bit about how important like a lab like this is to be able to work with TAs, students who are second years. How does this help you in your learning?
Yeah, so hands-on experience is honestly something that I felt like I lacked in my undergrad. So coming here and having so many resources and so many TAs and different professors to just help us get that hands-on experience is so valuable.
Hands-on experience. That's what we're about here at Plymouth State. That's fantastic. Thanks, Gracie. Good luck to you.
Thank you.
Nice to meet you.
You too.
Thanks. Fantastic. Well, I'm up here on the third floor in Samuel Reed Hall building. This is actually the nursing suite, but the Doctor of Physical Therapy program obviously needs to have practice working in hospital settings as well. So I'm with one of the faculty members in the DPT program to share a little bit about what the students are doing today.
So this is our Patient Client Management 1 course, which is one of the first courses the students encounter in the summertime, and they're learning their basic patient handling skills. So we're using this space so that they can get accustomed to the inpatient setting and the hospital beds and the wheelchairs and all those things. And today they're just practicing helping a patient transfer from the bed to a chair next to the bed or wheelchair.
Fantastic. Now, are these students first-year students, second-year students? Where are they at in their program?
These are first-year students, so they're in their first summer session, and this is their 6th week of the program.
Oh, wow.
So
Great. So this makes sense that
Brand new.
this would be an early class. I mean, this is like
Yeah.
getting people from bed to a place where they can get their therapy, and assisting with that is the bigger picture of what they might be doing as a therapist down the road.
Yes, and they're learning some of their basic core skills that are going to apply to working with any kind of patient. So when they come and work with us in our pro bono clinic starting in the fall, they'll have some of those basic skills ready to go, and they can start working with patients right away.
That's fantastic. Pretty cool to be able to share this space with the nursing program.
Yes, it's wonderful that we have this space, and nursing doesn't run any classes in the summer, so we actually have a couple of our skills classes that we use this space for in the summertime.
Fantastic.
Nice.
Great space here. Alums and donors, if you make it back to campus, we'd love to show you a tour and let you see what the space looks like in real time. Thanks a lot.
Thanks for tuning in to another episode of A View from Rounds Tower. As always, we love to hear from you guys, and if you have anything you want to see on these episodes, please email alumni@plymouth.edu. See you next time.